Good afternoon and welcome to the City Club of Cleveland. My name is Paul Harris and I am president of the City Club's Board of Directors. I'm very pleased to introduce today's speaker, Stephanie Kight, President and Chief Executive Officer of Planned Parenthood of Greater Ohio. The organization she leads was established in July 2012 through the consolidation of 3 Ohio Planned Parent organizations. As part of that restructuring, the organization also renamed its advocacy arm to Planned Parenthood Advocates of Ohio. It is an affiliate of Planned Parenthood Federation of America, and its mission, as stated at its website, is to, quote, strengthen individuals, families, and communities by promoting healthy and responsible decision-making about parenthood, relationships, and sexual health, end quote. Ms. Kight earned her Bachelor of Arts degree in Communications from Bowling Green State University. Before assuming her current leadership role, she consulted with and worked for several nonprofit organizations. She then spent 8 years with the Planned Parenthood organization in Southern California, where she employed her communications acumen in creating a social media department which established the nation's first sex education text messaging hotline. Now, the City Club of Cleveland would not be the renowned institution it's been for over 100 years if we didn't occasionally present speakers who had views that engendered robust debate. True to that historical tradition, Ms. Kight joins us 2 months after Ohio's governor signed into law the Ohio budget bill for the 2014-2015 biennium. In addition to highly publicized tax reform provisions, the bill includes new requirements on information that must be furnished prior to an abortion, so-called informed consent, and requirements for the determination of the presence of a fetal heartbeat prior to an abortion. And the bill also sets forth a new set of priorities for the distribution of public funds for family planning. I know you'll hear about that in a bit. The bill has drawn sharp and divergent reaction from abortion foes and choice advocates. A Toledo Blade story quoted the president of Ohio Right to Life's reaction, he's here with us today in the audience, to provisions of the bill as, quote, absolutely historic, close quote, and, quote, common sense provisions that will withstand court scrutiny, end quote. The bill has become part of the early campaigning for Ohio's 2014 gubernatorial election, and the debate in Ohio mirrors a debate that is occurring across the country and that received significant national attention when Texas State Senator Wendy Davis filibustered to prevent passage of new restrictions on family planning clinics in her state. So with that backdrop, I present on behalf of the City Club of Cleveland, Stephanie Kight, President and Chief Executive Officer of Planned Parenthood of Greater Ohio.
Thank you. Thank you. Thank you very much. Thank you so much for inviting me today to talk about the incredibly important subject of women's health care. Actually, Cleveland and the City Club have a long history of being part of this critical conversation. Let me tell you a story. In 1921, a young Cleveland woman, so desperate and distraught after learning she was pregnant with her 10th child, walked off a pier and drowned in the icy waters of Lake Erie, leaving behind her 9 children. She had previously talked to her physician, and he had adamantly refused to talk to her about birth control or any other manner of family planning. This was not an unusual situation at the time. Women were often desperate, depressed, and often destroyed by ceaseless childbearing. What made it different was that when 2 prominent Cleveland women read about this story in the Plain Dealer, they decided they had to take action. Dorothy Hamilton Brush and Hortense Oliver Shepard were junior league members and longtime friends who regularly volunteered at a prenatal clinic in East Cleveland. Their experience at this clinic, combined with the horrific death of this young Cleveland mother, led them to put together a committee that met at the Women's City Club in 1923. For 5 years, they discussed and planned and finally opened in 1928 the Maternal Health Association Clinic in the Osborne building at the corner of Huron and Prospect, not but a few blocks from here. This clinic became a leader in women's health by providing family planning information and services that other clinics and hospitals either couldn't or wouldn't provide. This is where Planned Parenthood got its start, and this is what we still do today. Now, I can't talk about Cleveland and Planned Parenthood and not talk about the Brush Foundation. It was also formed in 1928 when Dorothy's father-in-law, the inventor Charles Brush, endowed the Brush Foundation in memory of his son, Charles Jr. They began supporting the maternal health clinic right away, and still to this day are strong supporters of Planned Parenthood and reproductive rights around the globe. 1 year after the establishment of the Maternal Health Association Clinic and the foundation of the Brush Foundation in 1929, Margaret Sanger stood at this very podium. Well, maybe not this very podium, but she stood in front of the City Club advocating for the right of women to reproductive health care, including the legalization of birth control. She promoted support for the fledgling organization that would become Planned Parenthood. Now, more than 80 years later, after Margaret spoke, you've invited Planned Parenthood again today to talk about the efforts to defund Planned Parenthood, which means essentially to deny women access to reproductive health care, to take away essential health care services from the women that need them. There are concerted, well-funded efforts to put all women today and in the future in the situation that's just as desperate and tragic story as the young woman who stepped off that pier in 1921. How, after 8 decades, have we come back to the situation where doctors are once again told what they can and cannot do or even say to their female patients? I do appreciate the opportunity to address the City Club today because it's an incredibly important time for women's health care. We're in the midst of health care reform, which is giving women new access to essential health services. And at the same time, we are facing unprecedented and regressive state-level restrictions on that very same access. These opposing forces are creating enormous turbulence for women who simply want to get healthy and stay healthy. Before I talk about all that, I want to spend a few minutes talking about today's Planned Parenthood and the role of family planning in Ohioans' health. Now, I'm going to give you 3 numbers to remember from today's talk. Are you ready? You can write these down if you want. 1 in 5, 95%, and $6.46. Let's start with 1 in 5. 1 in 5 women in the United States have received health care from Planned Parenthood at some time in their life. 1 in 5. That's a remarkable number of people who have needed and received health care from Planned Parenthood. And it means that there's probably somebody in your life, in your family, at your work, in your church, synagogue, or mosque, in the grocery store, probably right here in this room today, I won't make you raise your hand, that have received needed health care from Planned Parenthood. How do we do this? Well, Planned Parenthood is a nationwide health care provider with nearly 750 health care centers throughout the United States, delivering health care to over 3 million women and men each year. We are actually one of the few health care providers with a nationwide health care delivery system. In Ohio, we have 27 health center locations. We serve nearly 100,000 patients a year, mostly women and some men. We love our men, with the majority of our patients ranging in age from 18 to 28. 1 in 5. It's a remarkable number of women who have turned to Planned Parenthood for health care. Let's talk about 95%. 95% of Planned Parenthood health services in Ohio are preventive health care, including breast cancer screenings, cervical cancer screenings and treatment, birth control, STD testing and treatment, miscarriage management, annual well woman exams, pregnancy options education, testicular cancer screenings, and next year we will add vasectomy services. And for women needing to end their pregnancy, Planned Parenthood is there. We believe access to safe and legal abortion is integral to a woman's reproductive health care, and it represents about 5% of our health care services. And as with most other health care providers, Planned Parenthood accepts private health insurance. About 19% of our Ohio patients use private insurance. The other 81% use either some form of government insurance or are self-pay patients. Okay, let's talk about $6.46. This is basic economics. Aside from the benefit to the woman and her family, family planning has a much broader societal impact. According to a study released by the Guttmacher Institute this spring, for every dollar we invest in family planning services, Ohio taxpayers save $6.46 in Medicaid costs. President Richard Nixon understood the economic importance of family planning back in 1969. In a message to Congress, he wrote, and I quote, "It is clear that domestic family planning services supported by the federal government should be expanded and better integrated. It is my view that no American woman should be denied access to family planning assistance because of her economic condition." In 1970, he signed into law the Title X program, a family planning program that to this day provides funds so that no woman in America has to go without family planning health services. Over 40 years after President Nixon signed Title X into law, President Barack Obama demonstrated that he also understands the importance of supporting women's health when he signed the Affordable Care Act. The ACA has outlawed the insurance practice of charging women more because they conceive and bear children, outlawed the denial of insurance for pre-existing conditions like breast cancer or rape, and made contraception part of women's preventive health care that must be offered with no copay. Thank you, President Nixon and President Obama. Not often you get to put those two names in the same sentence, right? I might also add that President Ronald Reagan signed California's implementation of Title X into law when he was governor of California. $6.46. For almost 4 decades, the economics of family planning has made sense regardless of political affiliation. 1 in 5 women use Planned Parenthood. 95% of our services are preventive, and $1 spent on family planning returns $6.46 in community benefit. Yet despite all of these positives, there has been an onslaught of legislation aimed at restricting access and reducing services for women, with one of the prime tactics being the defunding of Planned Parenthood. It's not good health care, it's not good economic policy, and it isn't even popular, not with the medical community, nor with the majority of the public. But it is a hugely important subject for a small but highly motivated group of people, a small group that have some powerful allies in state houses across America. You know, I'd rather not talk about politics today, mostly because my focus is on never again having a young woman step off a pier in despair because she couldn't get the help she needed from a trusted medical provider. That's the mission of Planned Parenthood, and that's my mission. Yet, here we are, and I'm going to talk about politics. If for no other reason, because I want you to understand how politics today are eroding the healthcare options available to women in our community, and it's those women who are suffering the consequences. Now, before we get into the details about the current political environment around women's health, I have to talk for a few minutes about healthcare safety. And I'm going to do this because many of the laws that we're going to talk about have been put in place to supposedly make women's healthcare safer, air quotes for everyone on the air. So let's talk about healthcare safety for a minute and the quality of Planned Parenthood care. I want to be absolutely crystal clear. Everyone wants healthcare to be safe. Everyone wants quality health care. Healthcare is a highly regulated business, as any of my healthcare colleagues in the room today will tell you. From the federal level to the state level, there are multiple agencies that oversee and regulate healthcare providers like Planned Parenthood. Now, Planned Parenthood in Ohio goes through a rigorous accreditation process similar to hospitals, is inspected and evaluated and audited annually by multiple agencies. Our family planning centers are staffed with advanced nurse practitioners who are specially trained in reproductive and sexual health issues. Our physicians are board certified and licensed to practice medicine in the state of Ohio. Our medical standards reflect our practice of evidence-based, patient-centered care. All of our medical protocols follow the strictest guidelines from the American College of Obstetricians and Gynecologists, as well as other nationally recognized researchers and institutions. Our two surgical facilities, located in Bedford Heights and Columbus, Ohio, well, you know you're in Ohio, are licensed by the Ohio Department of Health as ambulatory surgical facilities. Facilities that are inspected annually, at least annually, by the Ohio Department of Health. So why are legislators introducing myriad bills to make women's health care safer? Air quotes again. Because it serves as a cover for the real intent, which is to make reproductive health care services and health centers less accessible. The water thing is tricky. In the past 3 years, in state houses across the country, there have been 1,300 bills introduced, of which 211 bills passed regarding women's health care. Mostly about what I can and can't do about a pregnancy, when I can and can't get pregnant, about whether I can and can't make decisions about my own health care and my own body. Everything from New Mexico's failed attempt to criminalize physicians who end the pregnancy of a rape survivor because it's destroying evidence, to the infamous and now implemented transvaginal ultrasound in Virginia. This small vocal group of opponents and their state house allies have politicized women's health care. Not one of these laws reduces the need for abortion. They are designed to reduce access. These aren't just laws restricting abortion. They even restrict access to birth control and sex education. While Ohio hasn't received the same amount of attention as Texas, our legislature has been at the forefront of restricting access. Ohio has the most restrictive law regarding medication abortion. We have made one of the safest methods for ending a pregnancy unavailable for most women. And we have a nearly impossible judicial bypass procedure for teens independently seeking to end their pregnancy. And then, starting 3 years ago, the tidal wave began. The General Assembly has been pursuing a relentless agenda of restrictive laws that have no medical purpose. As a result of this agenda, enacted into law in Ohio over the last 3 years, Ohio has among the most restrictive set of rules, not only regarding abortion, but also women's reproductive health care. Let me highlight just a few of the laws that were enacted in Ohio in about 2 years ago. We prohibit qualified health care plans from providing coverage for abortion. We've banned abortions after 20 weeks, which is pre-viability, with no exception for rape or incest. And we've banned abortion in publicly funded hospitals. We live in a state where our finest healthcare institutions, like Metro Health or the Ohio State University hospitals, cannot provide the necessary care a woman may need because of politics. In our most recent legislative session, the Ohio legislature undemocratically added many of the women's health-related provisions with no public input and little public consideration to the biennial budget. Some of the highlights include the gag rule for rape crisis centers and their counselors, The legislature provided new funding for Rape Crisis Center, which is a wonderful thing. They desperately need the support. We should all support them. But in order to get this funding, they are not allowed to counsel about or refer for abortions. If they do, they will lose their funding. The second thing they did was they reprioritized family planning funds away from family planning providers like Planned Parenthood or Family Planning Associates of Northern Ohio. These are the Title X funds I talked about earlier. They're specifically for family planning, and the last people who are allowed to receive them now are family planning providers. And then there's the ban on the transfer agreements between public hospitals and licensed surgical centers that provide abortions. In order to be a licensed surgical center, you have to have a transfer agreement. Now, public hospitals can't have a transfer agreement with those surgical centers. The only option left are private hospitals, and in Ohio, a significant number of private hospitals are either in partnership or owned by the Catholic healthcare system. We have very few options left, and in Northwest Ohio, all the surgical providers up there have closed, and women must travel now to Indiana, Michigan, over here to Cleveland, or down to Columbus for care. And then there's the compelled speech for our physicians. Physicians are now required to conduct an exam to detect a fetal heartbeat. They then must notify the patient of the presence of the heartbeat, read a script telling the patient the statistical likelihood of the fetus being carried to term. Failure to do this results in criminal charges against the physician. Representative Ross McGregor, a Republican from Springfield, Ohio, was one of the politicians who voted against the budget. When asked about the stand he took, he said, and I quote, "These budget bills have become the repository for policy decisions. It's a lot more convenient to add these into the budget because they don't have to be bothered by people expressing their opinions." He further stated, "The process has been twisted so egregiously that it put me over the edge." We know how he feels. We live over the edge most days. But his legislative colleagues haven't stopped. There are currently 2 additional bills on the agenda for this fall that we know of. House Bill 248, the so-called heartbeat bill, has recently been reintroduced with the purpose of prohibiting an abortion after the detection of a fetal heartbeat. This usually happens around 6 weeks, well before most women know they're pregnant. Similar legislation is currently under legal scrutiny in other states. U.S. District Judge Daniel Hovland criticized a comparable North Dakota measure as unconstitutional, stating, quote, "The United States Supreme Court has unequivocally said that no state may deprive a woman of her choice to terminate a pregnancy at a point prior to viability." But Ohio moves ahead, regardless of constitutionality. House Bill 200 was introduced last April, and it includes more than a half-dozen additional restrictions. The most egregious of the provisions is the requirement that a physician provide information known to be false. House Bill 200 would force a provider to tell a woman that terminating her pregnancy increases her risk of breast cancer. Neither the National Cancer Institute nor the American College of Obstetricians or Gynecologists has found a link between abortion and breast cancer. You know, what's even more frustrating and discouraging is that the legislature didn't pass laws that would have improved women's health, and they had the opportunity to do so. For 2 years, the Ohio Prevention First Act has been stalled in the House committee. This bill puts into place some common sense measures, like access to emergency contraception for rape survivors at all hospitals, medically accurate sex education for high schools, and other teen pregnancy prevention measures. Yet, it has had only one hearing. Medicaid expansion is stalled and appears to be headed to the ballot box if we want to expand that. And one of the most devastating effects of this politicizing of women's health care is that we are ignoring the broader health outcomes related to pregnancy. In 2011, Ohio had the second highest infant mortality rate in the country for African American babies, 13th highest overall for the overall population. One of Ohio's leading experts in the area of infant mortality, Dr. Arthur James of Nationwide Children's Hospital, anticipates that when the 2012 numbers are released at the end of the year, Ohio will have the highest infant mortality rate for African American babies in this country. That's appalling. And yet, our legislators spend their time trying to take family planning services away from women. It's clear that many Ohio legislators don't put the health care of Ohioans ahead of politics. But Planned Parenthood does. The good news is we do know how to impact infant mortality rates. More family planning. We run a specialized program in the Mahoning Valley that has brought down infant mortality rates through good family planning and parenting education. We also know how to bring down the rates of unintended pregnancy, the leading reason women want to terminate their pregnancy. Family planning. So instead of trying to put us out of business, our legislators should be working with us for the common goal of a healthier Ohio. I'd like to suggest 4 things that we should do to improve Ohio's health outcomes. 1, all young people should receive accurate, comprehensive sex education. Sex ed teaches young people to be responsible with their bodies and to respect other people's bodies and emotions. Studies show that young people who get comprehensive sex education delay their first sexual encounter. And young people whose parents talk with them about sexuality have healthier relationships. Accurate information is one of the best medical tools we have and one of the easiest to use. 2, let's make contraception widely available, and let's make long-acting, reversible contraception affordable. A recent University of Washington study offered 9,000 women their choice of any contraception on the market for free for 2 years. There are 2 critical findings. Women overwhelmingly chose the long-acting reversible methods like an IUD or a Nexplanon, which is the rod that goes into your arm, hormonal contraceptive that lasts for 3 years. As a result of the widespread use of long-acting contraceptives, abortion rates among this group were 70% lower than the national average for the same demographic. 70%. Lowering abortion rates by 70% because they were less necessary, not because they were more difficult or dangerous. This should be comfortable, common ground. 3, every pregnant woman without private health insurance should be automatically enrolled in Medicaid to receive immediate prenatal care. It's called presumptive eligibility, and it would dramatically increase maternal and infant health. 4, let's demand that no law will be passed that deliberately makes a healthcare procedure more dangerous. And let's demand that these politicians get out of our exam rooms. And one last thing. For those of us who've been fighting this fight a long time, we've got to take back this conversation and own it. We must move away from the divisive conversation characterized by old labels, pro this, pro that, anti this, anti that. These labels don't reflect the real-life conversations that are going on in Ohio today. And they alienate our young people. And we desperately need them to be part of this conversation. Let's have a real conversation with care, without the labels and the judgments they carry with them. At Planned Parenthood, care isn't just a health service. It's the attitude with which we approach the world. We care with passion and with conviction. We stand with women and support their rights. We work to ensure that all people have access to high-quality health care and sexual health information. We care no matter who you are or what you need. We care no matter your religion, your sexuality, or your political persuasion. The Centers for Disease Control and Prevention identified family planning as one of the 10 important public health accomplishments of the 20th century. We owe it to that young woman who stepped off the pier in 1921, and to Dorothy and Hortense, and to the young women of today and the young women of tomorrow, to not abandon this important public health accomplishment. Thank you so much for your time today.
Today at the City Club of Cleveland, we are listening to a Friday forum featuring Stephanie Kight, Executive Director of Planned Parenthood of Greater Ohio. We will return to our speaker momentarily for our traditional City Club questions. We encourage you to start formulating your questions now, and would respectfully request that you keep them brief and to the point, and actually structured in the form of a question. We welcome all of you here and those joining us via broadcast on WVIZ PBS, 90.3 WCPN, and 104.9 WCLV IdeaStream, WTAM, or one of the many broadcast partners across the country. Broadcasts of the City Club are made possible by Cleveland State University and PNC, and our live webcast is supported by the University of Akron. There's a lot of activity here at the City Club in the month of September, a conversation about the changes at Cleveland's daily newspaper, the Cleveland mayoral debate, the state of the schools with Cleveland Metropolitan School District CEO Eric Gordon, and author of The Metropolitan Revolution, Bruce Katz, co-founder of the Brookings Institute. Please visit our website, www.cityclub.org, for more information about our upcoming forums, to make a reservation, or to order a CD or DVD of one of our many programs. We welcome guests today at tables hosted by the ACLU of Ohio, the Gun Foundation, and Planned Parenthood of Greater Ohio. Thank you all for your support. Now, as promised, we'd like to return to our speaker for a traditional City Club question and answer period. We welcome questions from everyone here today, including guests. Holding the microphones today are City Club Program Director Carrie Miller and City Club Operations Assistant Maria Debate. First question, please.
Ms. Kight, we certainly thank you and your staff for the work that you do in protecting the health of women in Ohio. One of the strategies that you mentioned was the importance of all young people having accurate information around sex education. Would you talk a little bit more about what Planned Parenthood does in terms of sex education? How early do you start it? What are some of the programs? Are there differences in the way sex education happens today than it did, say, 3 or 4 years ago? And what's the status of abstinence only?
Wow, that was a lot of questions. Thanks, Barbara. So at Planned Parenthood, we have a variety of sexual health education programs. Some of them are classroom-based. We're in the Cleveland Public Schools providing education for your teens. And around the state, it's a little bit different. We have a very robust peer education program in parts of the state where we train high schoolers with all the information they may need to be a good peer counselor in their high schools. And so most of our programs are done at the high school level. We also have a parent education program for any of you out there who might be a little nervous about talking to your young people about sexual health education. We can talk with you about how to do that. Around the state of Ohio, we actually in Ohio don't have a curriculum standard for sex education in our state education curriculum, so it's quite hit or miss around the state of Ohio in terms of what your student may get. Depends entirely on what high school they go to. So it's all over. And abstinence only is, it still gets funding from the national level. Very disappointed about that. I might remind everyone that comprehensive, there is no opposite of comprehensive, right? Comprehensive is comprehensive. All of our programs include abstinence discussion as the only 100% sure way to not have an unintended pregnancy or an STD. But we also talk about all the information a young person needs to know to keep themselves healthy and safe.
I'd also like to thank you for the work that you do and your staff. With the infant mortality rate being so high among the African American race, what kind of outreach do you have? And I don't know what kind of staff you have, what kind of funding, and I guess you're not going to have as much. But do you have any outreach to low-income areas, to homeless shelters, so that people who need the help can get the help, as opposed to waiting for them to come in to you?
Right. That's a great question, and I'm glad you share my horror at that statistic. It depends by region in terms of what we get funded for to do outreach programs. So in some places like the Mahoning Valley and here in Cleveland, we have good outreach programs where we get into either the schools or the community shelters, working a lot with churches to make sure there's a connection, that people know where our health centers are. We try very hard to put our health centers in communities that are underserved in the area of health care, so that the population knows we're there and have these health care services. I don't think we could ever do enough in this area, and it would be my wish that we could have some kind of an outreach program in every community, because I don't think women know how available prenatal health care is and how important it is to their birth outcome. So thank you for that question.
Stephanie, you spoke about the legislation that's been adopted in the past year by various states, draconian, a great deal of it, regarding women's rights, and certainly against Planned Parenthood. For many years, though, there has been a certain antipathy by very conservative members of the legislatures throughout the country regarding Planned Parenthood and regarding women's rights to their reproductive production. But my question is, it seems to be a plethora of legislation, as you pointed out, including Ohio, which has a very serious draconian legislation regarding women's rights. How do you account for this, and what's happened in the last year to make these legislatures do these things?
Well, that's probably a subject for a whole other speech in political science, but I do think that we saw a dramatic shift in the composition of the number of governors and state houses that are populated with people who have a political agenda against women's reproductive health care. So the states where you've seen the most dramatic laws, like Ohio and North Dakota, there's about 15 of them that are really, really in serious trouble with their health care rights, tend to be dominated by people who just don't think we have the right to control our own body. And most of them came into office during the 2010 election cycle. That's sort of a simple answer to that, but it really has to do with the composition and their commitment to this. And I'm guessing this appeals to their base, to use that oh so political term. Does that make sense? You don't look like I'm getting at your question. Is that good? All right. Next question.
Thank you so much for being here.
My pleasure.
My question is regarding a provision that I heard where the waiting period is being extended from 24 hours to 48 hours, and the conditions for a waiver has been increased, and now the provision is death of the woman rather than her health. I heard many doctors discussing this the other day, and they were expressing their concern about this because very often when a woman is going through a medical emergency, and pregnancies that women want, you never know what's going to happen, and the doctor, in this emergency, has to decide on the spot whether it is death or not death, and whether his or her license could be taken away, they will err on the side of caution. And that may mean a woman's life. I maintain that this state has become the most dangerous state in the country. I mean, a very dangerous place for women to live if they're of childbearing age. My question is I'm not sure, is this provision in the budget, which is already law, or is it a proposed law that we might be able to have something that we could do about it?
Yeah, it's coming up in House Bill 200. They had it in the provision that was introduced last fall, and it didn't make it into this budget. They put a bunch of the stuff into this budget, but not those two. So let me address two of those issues. The waiting period. We currently have a 24-hour waiting period. It's a huge impact on a woman, especially now that they're going to have to travel farther, and particularly big impact on low-income women who may have to take time off of work and come for 2 different appointments. So they want to extend that to 48 hours. I might remind you, I believe it's South Dakota that has the 3 business day waiting period. And remember, in South Dakota, there's only one surgical center, so 3 days is a big deal. So this trend of creating longer waiting periods is very scary. The one important thing to remember is that women think about this procedure. They think long and hard about this in their life. Another 24 hours is often just inconvenient. But it's put in place because, of course, that's what our opponents want, everything to be inconvenient. Women think about this. I know I've been doing this work for a long time. I've met a lot of women who've terminated their pregnancy, and it is a very complex decision that they make. So, and I don't know, the other piece about the physicians, I mean, this attack on physicians' ability to practice their medicine to the best of their ability is very frightening. And I know we're hearing from physicians all around the state about this concern that politics is getting into their ability to practice the best medicine they can.
Hello, Stephanie. Thank you for being here. Could you elaborate on your earlier point about the language that we use for this conversation and debate, the pro and anti, and say a little bit more about what you think the alternative to that is?
Well, here's the alternative. What we really all want, am I allowed to walk out around here? Okay, thanks. What we all really want, and what even the studies show where America's at, is that America wants abortion to be safe, and we know for it to be safe, it needs to be legal. And that's what we need to fight for every day, is simply safe and legal abortion. And that's the handle, if you will, that works the best in the public. And the reason that it's so important to walk away from some of the old structures is that really, and I've looked at a ton of research in this area, the generations coming behind us in particular, this doesn't work for them. It just reflects a conversation that is politicized and vitriolic. And this is way too important of a healthcare issue to let it be destroyed by a political conversation. So our challenge is to find a new way to talk about it that invites the people who have very real conflict about this procedure, understandably, and invite them into the conversation, because we know that even if you have a conflict about the procedure, you still want it to be safe. And to be safe, it needs to be legal. We know that. Does that help? Okay.
Hi, Stephanie. Thank you so much for being here. I have a 21-year-old daughter, senior in college. She's got a cousin who's just 2 months older than her. What can we do, what can you do to reach out to these young women whose very rights to exist in our state are being threatened? I mean, let's get them involved in some way.
Right. We need these young women every day. We need them to vote. We need them to organize. And I think it's really part of the job that we all have is to talk to our younger generation and explain to them, where's our baby back there? I'm not so sure that these rights are going to be available for her if we don't do something about it, and if we don't get your daughter to stand up and get involved. I have looked at all of the polls. The majority of Ohioans both support Planned Parenthood and support access to safe and legal abortion. We need to help them understand that this really is at risk right now. And so to be able to get out onto college campuses and talk about what's at stake every day in Ohio when we let these bills pass, to elect fabulous officials who will stand up for women's rights and do the right thing when it comes into the legislature. So really, one of the things each one of us could do, actually leaving here today, there's 2 things you could do. I have more instructions for you. You should have this conversation with your daughter or the other 21-year-old in your world, wherever she or he is, and we need the men. Thank you for all of you who came today. We need the men fighting for this as well. Have this conversation and tell them what's at stake and that we're not kidding. I've given you a lot of facts today to show that they are very serious in the State House about taking these rights away, and we need to be just as serious about protecting them. Here's the other thing you can do, and this is back to your point. If you have a physician, talk to him or her about what's going on. Tell him or her what's happening to their ability to practice medicine. All of the women in this room have an OB-GYN. Talk to them. Explain to them what's happening and that they need to take action. They need to stand up and say, what the heck are you doing to my medical practice? So talk to those young people and talk to your physicians. Thank you very much. I wanted to thank you also. I know, Connie, you've done a lot of work for us. I've slammed the legislature today, but I know that you've been a champion for standing up for us, so thanks.
Ms. Kight?
Oh, hi.
Hi. I was really fascinated to hear about the study that you described where 9,000 women had been offered 2 years of any kind of free birth control support. And I'm amazed I haven't heard of it before because it sounds like a very potent piece of work. And I would ask you to return to that topic a little bit because cost-effective ways to avoid abortion hold the potential to build conservative and liberal support
Right.
for measures that then have a greater chance of being funded and not being declared legal. Would you tell us how well the results of that study were received by, let's say, in particular, the conservative side of the spectrum?
Well, I don't hang out over there too much, so I'm not positive. But let me answer it this way. It was an amazing study, and for any of you who want any of the studies I referred to or background on any of the numbers, if you'll leave your name and email address with our staff, we'll get that to you, so if you'd like that study. But one of the troubling things about this conservative wave around reproductive rights, and it's happening here in Ohio, we have a number of Ohio legislators who actually want to make an IUD a form of an abortion. They don't call it birth control because of how it works, because they believe the moment of conception, the moment the sperm and the egg meet, is where we should draw the line. And so one of the troubling things is when you bring this study out, and you're just, it was overwhelming for all of us. For as long as I've done this work, I was stunned by the results and excited by the results. But there hasn't been a particular level of excitement about seeing this as common ground. We haven't found any open ears in the State House who would say, yes, let's make this totally available. I mean, I think we're making progress with the ACA because it's going to be a little more affordable for women. Unfortunately, insurance companies, including Medicaid, don't reimburse for these long-acting methods very well, so women still have to pay out of pocket for that. I'm happy to know, I know a lot of you in the room have funded Planned Parenthood, that we often do that co-pay for them. But I think it's the thing we should all move forward on, is like, let's make that the most affordable, the single best choice. That's our healthcare mission. We work in Planned Parenthood. The number one thing we want that woman to walk out the door with is a long-acting reversible method, because we know that we'll never see her then in our surgery center. And that's our goal.
Hello, thank you for being here today. It's very educational. Just a quick question. This is obviously a conversation that affects everyone.
Mm-hmm.
So what are you specifically doing to talk to some of the other states where these sorts of bills are being enacted to get it to be a national conversation?
Wow. Isn't that the question of the day, how we get this up high? We are doing, actually, as Planned Parenthood, we're doing a lot of work. We're actually going to be having, those 15 states I identified are working together very closely to talk about what we can do as a group of states who are so dramatically affected by these laws to either develop legislation that would make sense to Ohioans. So that's one thing that's going on. And then as Planned Parenthoods, we do a lot of work together to bring healthcare policies, healthcare procedures, workarounds. How'd you get around this bill? How are you still serving women? What are you doing with women who can't get the care in your state? So for us, for example, if we need to let a woman know that she's going to have to go to Michigan to terminate her pregnancy, we work with our partner affiliate in Michigan to let them know you're going to be seeing a lot more patients from Ohio because they're going to have to travel to see you. So there's different levels. There's the healthcare level of making sure we've got the healthcare we need, and then the policy level. And we really do have some fabulous champions in the legislature who are trying desperately to raise their voices. And I think we're going to start connecting them across the country, and that'll hopefully raise the issue. Thank you for that question.
Hi, Stephanie. Over here.
Oh, Mom!
Yeah. I really appreciate the fact that you brought up that the discussion needs to expand beyond pro-choice and pro-life, because I really think that that distracts a lot from the greater issue of reproductive justice. And I'm wondering if you, maybe I'm just being paranoid here, but do you think that possibly it could be a political tactic to emphasize abortion to distract from the greater issue of women's health?
Well, everything gets politicized these days around this issue, so I'm not sure that we can come up with any language that doesn't get co-opted. But I think we can, the real goal is to have, our real goal is the same goal as the City Club, right? To have a civil conversation about a really important health care situation in Ohio. And if the language distracts, then we just need to keep finding language to help the conversation and help people feel comfortable about it. There's a lot, we don't have to talk about just safe and legal abortion. That tends to be the most, the lightning rod around it. So at least taking that out and finding a calmer way to talk about that acknowledges the people in the middle and where they're feeling. That helps bring the temperature down a little bit and invite calmer, more middle-of-the-road voices to the conversation, which I actually think will help the overall conversation and begin to give us a bigger audience for that broader reproductive justice conversation we all want to have. Okay. Thank you.
Thank you for your excellent presentation.
Thank you.
I'm surprised there's no mention of the church or religion in all of this, and yet it seems to me that is certainly one of the major sources of the debate that exists across the country and of the legislation that is currently passing. My question is, what is Planned Parenthood doing with regard to dialogue with the church, however you define that?
Well, I'm very proud to tell you that we have an amazing Clergy for Choice program that is all over the country, but here in Ohio, the chair of Clergy for Choice lives right here in Cleveland, Missy Shiverick. Did I say her name right? Let's get that right. Thank you. And the vice chair of Clergy for Choice, Rabbi John Adler, lives in Canton. So Ohio right now is leading the country in that very conversation about where does the church's voice, the progressive church, the church that cares about reproductive justice and all justice, where's that voice of faith coming into this conversation? And we do look to our faith leaders to engage that conversation. We have an ongoing conversation with them. We also believe that a patient's faith is their private matter. So when she's in our health center and we're providing care to her, that's her private matter, whatever faith she brings with her. We respect that. And so that's one level of it. At that national level, it's a very robust conversation that's going on. I think the woman who did what's the name of the woman who did Nuns on the Bus? Remember, didn't she move to Cleveland? Yeah. You guys are totally rocking it here in Cleveland. So there's some amazing faith leaders out there who are bringing a reasoned, calm voice of faith to to this whole discussion. Now, why that gets drowned out by the larger voice, I don't know, but I think there's a strong faith voice here. And someday you can invite one of them to come and talk about it. Hi.
Hi, Stephanie.
Good to see you again.
Yeah, you too, you too. I wanted to ask you if you can comment on whether or not the American Legislative Exchange Commission has had any, or Council has had any role here in Ohio regarding women's reproductive health. Alec?
Well, and I just should point out that this is going to be our last question, so it's a good one to end on. ALEC has definitely had a huge role in what we're seeing in Ohio. Of course, they've put together about 30 pieces of model legislation that they have dispensed to all of the states in the union to put into place. That's why you're seeing similar laws popping up all around the country, because ALEC put them together, tested them out for either legal or reasons to make sure they could hold water, if you will. And they've absolutely, I think that's where we're seeing House Bill 200s coming out of that, the recent legislations come out of that, and of course the heartbeat has been one of their favorite pieces of legislation that they're floating around the country. So absolutely they're playing a big role in what's happening around. Yeah, sure they do. Yeah, and they fund them. So they develop the legislation, they fund the legislation, and they fund the elected officials who are behind that legislation. This has been a fabulous conversation today. Thank you so much.
Today at the City Club of Cleveland, we've been listening to a Friday forum featuring Stephanie Kight, President and CEO of Planned Parenthood of Greater Ohio. Thank you very much, Mrs. Kight. Thank you, ladies and gentlemen. This forum is now adjourned.